to study about the rectum and anal canal. So we already studied the large intestine. This is the sigmoid colon. So from this is the sigmoid colon. So sigmoid colon continues downward as rectum. Rectum, the name implicates it is a straight tube, but in human beings it is not straight. Here you can see some curvatures are there for this rectum. And the rectum extends from, it lies in front of the sacrum and the coccyx. This picture we can see, this is the sacrum and below the sacrum comes the coccyx. So this is sigmoid colon in front of the sacrum, that is in front of the third, from the third, fourth and fifth the sacral vertebrae. Okay. It lies in front of the third, fourth and fifth sacral vertebrae and also coccyx. Below this coccyx will come. So it extends from the sigmoid at the end of the sigmoid. This is known as rectosigmoid junction between the sigmoid colon and the rectum. So it starts from the rectosigmoid junction, then it lies in front of the third, fourth and fifth sacral vertebrae and also the coccyx. And it ends at the junction between the anal canal and the rectum. That is in front of the tip of the coccyx. Up to there we can see the rectum. So here comes the anal canal. This is the anal canal and this is the rectum. And it has a length of about 12 centimeter, that is 12 centimeter long, and width of about 4 centimeter in the upper part. The upper part it is 4 centimeter in width, but when coming to the lower part it forms a dilated portion that is known as ampulla. So this is the ampulla in the anterior aspect. This is known as ampulla, or the anterior projection of the lower end of rectum. So it ends in the ampulla. So this is the ampulla. Then course and direction. So it is, this course it is directed first downwards. It comes downwards, then it goes backward. First it goes downwards and backward, then finally it goes downwards and forward. First downward and backward, then it goes downward and forward. Then at the end of the rectum, the rectum lies in the median plane. Lower portion lies in the median plane, and it has two curvatures. There are antero-posterior curvature, two antero-posterior curvature and three lateral curvatures. Curvatures means curves. So the two antero-posterior curvature, there are two antero-posterior curvature. That is, here we can see this is the sigmoid colon and this is the rectum. This is anterior part, this is posterior part. Here we can see the sacrum and coccyx. This is anterior part. Here we can see the urinary bladder, uterus and all. So there will be an antero-posterior curvature for the rectum. The first curvature is the sacral curvature. That means it follows the concavity of the sacrum. You can see it is convex backward, going backward, convex. Then in the lower part, it comes anterior and downward, like this. So lower also, anteriorly one convexity can be seen. So first one is, it is convex backward, then it convex anteriorly. So two antero-posterior curvatures can be seen in the upper end and the lower end. Upper end, it follows the concavity of the sacrum and coccyx. Then in the lower part it forms a bulging. So that is anal. This is known as perineal flexion. This is known as sacral flexion. This is known as perineal flexion. So this is the antero-posterior curvatures. Then in addition to the antero-posterior curvatures, there are three lateral curvatures for the rectum. So in this picture, this is actually showing the interior of the rectum, but here we can make out the curvatures, lateral curvatures. So in the upper part, it is convex to the right. This is the right side and here comes the left side. And in the upper part, there is a convexity in the towards right. So there is a lateral curvature towards the right side, and the middle part there is a middle curvature in towards left side. Okay. And in the lower part again we can see another curvature, convexity towards the right side. So there will be two right curvatures in the upper end and the lower end, and one left curvature in the middle part. So 3 lateral curvatures for the rectum. Relations of the rectum. So anteriorly, in case of females it is different. Males and female difference will be there in the anterior relation. So anteriorly, in the case of males, this is male section. So here we can see anteriorly this is our rectum, and anteriorly it is related, the upper part of the rectum is related to a pouch that is known as rectovesical pouch. So this is our urinary bladder. So between the urinary bladder and the rectum there is a pouch, peritoneal pouch can be seen, that is known as rectovesical pouch. So inside the rectovesical pouch we can see the small intestine, coils of small intestine and the sigmoid colon. Okay. So it is the upper part, it is related to the sigmoid colon, coils of small intestine and the rectovesical pouch. The lower part it is related to urinary bladder. So this is the urinary bladder. Lower part is related to urinary bladder. Then here comes prostate. This is the prostate. Okay, prostate, urinary bladder, seminal vesicles. Seminal vesicles are related to the lower part of the rectum. And in case of females, this is female section. In case of females, the upper part of the rectum is related to, this is the uterus. So between the uterus and the rectum, rectouterine pouch. This is the rectouterine pouch. Okay. So it also contains sigmoid colon and coils of small intestine. Okay. So rectouterine pouch instead of rectovesical pouch, here comes the rectouterine pouch. In the lower part, it is related to, this is the vagina. So it is related to vagina anteriorly. Okay. Then posterior relations. Posterior relations are common both in male and females. Here we can see it is related to lower part of our sacrum. That is related to third, fourth, fifth sacral vertebrae. Then coccyx. This is the coccyx. So it is related to the lower part of the sacrum and coccyx, both in case of males and females. Okay. Then comes the anococcygeal body. Then like that, perineal membrane, and vessels, everything will be there. That's all about the relations. Then comes the interior of the rectum. So this is the picture showing the interior of the rectum. And interior of the rectum, the mucous membrane shows two types of foldings. One is longitudinal foldings and the other is circular foldings. The longitudinal foldings are transitory. It is not permanent fold. It is temporary foldings only, the longitudinal foldings. But the circular folding, and that is transverse folds, they are permanent folds. And the longitudinal folds will present only in the lower part of the empty rectum. Empty, when rectum is empty, we can see towards the lower part longitudinal folds can be seen. Okay. But the transverse or the horizontal folds, they are known as valve of Histons. Histons valve. They are known as Histons valve. Valve of Histon or Histons valve. Okay. So here there will be permanent. They are permanent mucosal folds, and they are of 3 number. 1, 2, 3. These 3 foldings can be seen. The first fold, transverse fold, lies near the upper end of the rectum. It lies near the upper end of the rectum. So this is the upper or the superior transverse fold. This one. And it can be seen 7.5 centimeter from the anorectal junction, from the anus, or 7.5 centimeter above the anus. From the anus, it lies 7.5 centimeter above. It is a permanent fold, and it is seen towards the left wall of the rectum. From the air rises from the left wall of the rectum. That is the first one. And the second fold, this is the most prominent fold and the largest fold, then it is seen from towards from the right wall of the rectum, from the right wall, and this is the largest fold, and it projects from the anterior and right end of the right wall of the rectum. Then next is the third fold or third transverse fold, and it lies 2.5 centimeter below the second fold, 2.5 centimeter below the second fold. So this projects from the left wall of the rectum. So from the left wall, two folds can be seen. First and third is seen in the left wall, and the middle can be seen from the right wall. So these are the transverse fold or permanent fold seen inside the wall of the rectum. They are known as valves of Houston. Houston's valve. A valve of Houston. Then blood supply of rectum. Rectum is supplied by superior rectal artery. This is superior rectal arteries. It is supplied by superior rectal arteries. Then inferior rectal arteries. And it is middle rectal arteries, then by the median sacral artery. This is median sacral artery. So rectum is supplied by the superior rectal, middle rectal and median sacral arteries. Then venous drainage is the superior rectal vein, by the superior rectal vein, then middle rectal vein and median sacral vein, corresponding veins. Superior rectal vein, this one, then middle rectal vein, then median sacral vein. Okay. So this forms plexus and the walls of the rectum. Then lymphatic drainage, upper half of the rectum drains into the inferior mesenteric lymph nodes. Then lower half drains into the internal iliac lymph nodes. Upper half to the inferior mesenteric lymph nodes, and lower half to the internal iliac lymph nodes. Then nerve supply. Both are supplied by the sympathetic and parasympathetic. Then sympathetic from the L1, L2 segments, then parasympathetic by the S2, S3 and S4 segments. In applied anatomy, one of the applied anatomy for the rectum is one digital per rectal examination, ER examination. That means it is a examination of the rectum by inserting the fingers inside the anal canal and it reaches the rectum, and so we can feel the finger will be passes through the rectum, and we can feel the structures and the anterior part of the rectum and the posterior aspect of the rectum. So both in the during parturition time also we can feel the head of the fetus through this through the PR examination. Then another applied aspect is carcinoma in the rectum. It is usually quite common. Then next is collapse of the rectum. Rectal collapse. So it's a condition in which the rectal wall will be protrude through the anus. So rectum will be falling, passes downward and can be passes downward through the anus. That is rectum, prolapse of the rectum. Okay, so these are the, and we are examination, the internal examination through not through the fingers. We can insert the protoscope or sigmoidoscope instruments also we can insert through the rectum and to see the interior of the rectum. So that is known as protoscopy or sigmoidoscopy. So these are the clinical anatomy for the rectum.